One of the most common questions we as radiation oncologists get is you're saying various techniques of radiation therapy is available, something like IMRT, IGRT, VMAT, rapid arc, 3D CRT, 2D RT, A square plus B square is equal to 2AB. We are not understanding any of that. I hope this video will clear it up for you. So let me start with 2D RT. 2D RT is dubbed as conventional radiation therapy, wherein we use the open radiation fields to treat the tumor and its surrounding site. It's more like if there is a stain in the wall and you want to clean it, and all you have is a bucket and some amount of water in that. How do you clean it? Take some water and just throw it at the wall. So the stain will definitely go, but the surrounding area will also get wet. That's what happens when 2D RT technique is used. So the tumor will also get the radiation. The surrounding structure, say it's a bladder, the rectum, any critical structure which is around is also going to get the radiation. So even though the tumor is going to get treated, the surrounding area will get the same amount of radiation that the tumor gets, and it might go into permanent dysfunctions. Next comes the 3D RT. 3D RT is 3D CRT basically. 3D CRT is 3D conformal radiation therapy. In this, what we do is take the same stain on the wall, for example. We mark exactly where the stain is there, and we take a hose pipe and we try to paint only in the marked area, something like that. Next comes the IMRT. IMRT is nothing but intensity modulated radiation therapy. In this treatment, what we do is we use something called the intensity modulation. That is, particular site of the cancer will get a high dose, and the surrounding structure will have a reduced dose. More like you're setting up, or if you're doing a vlog, there will be focus light on you, and there will be dull light behind you, and there will be some extra colorful light next to you. Similar to that, IMRT does that. Only the tumor will get the higher dose, and the remaining surrounding structures will get a reduced dose or no dose at all. So such type of treatment is useful for cancers of head and neck, and cancers of the esophagus, and even in some cases of bladder cancers. Wherever we need to spare the surrounding structures, this will be very helpful technique. Next comes the IGRT, image guided radiation therapy. This is nothing but IMRT, but with a daily imaging. What is this daily imaging, you can ask? So in IGRT, what we do is each and every day we'll be taking an image before starting the treatment. So with that, what we can do is, if at all the organ is doing some movements every day, one day the organ is in some place, the next day the organ has moved a bit, and the tumor has also moved. And that way, if we don't have image guidance, we might be treating the site where the tumor is not there. So in such setups, IGRT is more useful. Then comes the arc therapy. Arc therapy is basically volumetric modulated arc therapy. In this technique, what happens is the machine takes one complete circle, complete arc. That's the reason the arc is included in that. So through this, the tumor gets treated like in a very, very precise format without very, very minimal dose falling on the surrounding structures. Instead of giving an example, I can just give a clinical scenario for that. Say there is a 38-year-old person who is getting treated for cancer of the throat with IMRT. And at the same time, there is one other lady, some 90-year-old lady. She is getting treated for the same throat cancer with VMAT technique. We see the VMAT person, the 90-year-old lady, doing better until the end of the radiation. At the contrast, if the IMRT patient, that 38-year-old person, he will come back to me within say 18 or 19 days saying that he's having a lot of difficulty swallowing, a lot of pain due to the radiation effects and all that. They'll be coming with that. So it means to say the radiation delivery is better when compared to the previous technique I said with the arc therapy. I hope this gives you clarity with regards to radiation therapy. When it comes to radiation therapy, always consult a radiation oncologist. Ask them doubts, ask them more questions, understand what kind of tumor needs what kind of technique, which will suit better for the particular patient. Because radiation therapy evolved to make it tailor-made for a particular case scenario. So when it's readily available, it's better we use it and use the right technique that is needed.